And we now have Dr. Kevin Pawlowicz. Now, Dr. Pawlowicz, you've used this technology too in your own practice.
I have.
What do you think about how hard it was to actually integrate this into your workflow, especially because you are placing your own implants, correct?
Correct. Yeah, the main thing that I found was prior to getting the technology at the office, I thought that it would be difficult and sort of put off the whole process. The thing that I was the most stunned about was how simple it actually was. Very intuitive, everything sort of falls right to place. My staff was the ones who were really bouncing through and showing me things as we were going. Very easy to...
Which seems to be tough, because a lot of times it's tough to introduce new change to an office because everyone's kind of used to doing things a particular way.
Oh, they love it. They love it. They feel like they've taken the entire practice to a whole new level, and they're excited to come to work. It's fantastic. It's changed the way I practice.
I was going to say, what do your patients think about seeing their teeth scanned in, all the 3D stuff happening too?
It's well, obviously the first comment is I've never seen anything like this.
Yeah.
In terms of my patient acceptance, I have no patient has yet say they're not coming back because that's entirely too much. They're all very much blown away by what's going on. It's been fantastic and been a great referral source so far.
Right, and now it's all in your office too. You're not having to send anybody out to an imaging center to get that first scan done.
Correct. Yes, and we were sending to the imaging centers before, and we've been digital X-rays. And now that I've got it, it's the difference between going from black and white to color. And even beyond that, it's like going from color to HD. Yeah. So I can't go back. When I look back even at my digital X-rays and I try to scan through the X-ray periodically and realize I can't. Yeah. So I can't, it's one of the pieces of equipment that I can't practice without any longer.
So could you ever imagine going back to the way you did things in 2D?
No, CEREC changed the way I practiced dentistry in the first place. Yeah. And I was thinking about this just last night. The CEREC would be the one thing I couldn't live without. And then the Galileos and the tie-in would be the second piece of equipment. And then probably my hand pieces would be third.
And then hand pieces after that. Well, Doctor, thank you so much. I'm Dr. Jeff Rohde with Dental Compare.